The House Health Policy Committee will come to order. Would the clerk please call attendance?
Chair VanderWall.
Present.
Representatives Thompson. Present. Meerman.
Here.
Tisdall.
Here.
Beerline.
Here.
DeBoer.
Here.
Preston.
Here.
Schmaltz.
Here.
St. Germain.
Here.
Bohnak.
Here.
Frisbee.
Here.
Whitsett. Carter.
Here.
Whitwer. Neely. Hoskins. Foreman.
Here.
Mr. Chair, you have 13 members present. You do have a quorum.
Thank you, Madam Clerk. Representative Preston moves to adopt the minutes for the June 11th meeting. There being no objection, the motion passes. Today we are going to be voting out House Bills 4306, 4307, 4558, and Senate Bill 303. We'll also be taking testimony on House Bill 4484, 4509, and 4591. With that, we are now going to move to testimony on House Bill 4484, introduced by Representative Fox. Representative, if you could make your way to the testimony table. Is everybody that you have with you, or? Yes, okay. Whenever you're ready, Representative, if you can hit the button in front of the mic, the testimony table is yours, and when you're done, we will go to your speakers and then move on with questions.
Thank you, Mr. Chairman, members of the Health Policy Committee. It's good to be here with you. Honored to speak to you this morning in support of House Bill 4484. This is a common sense piece of legislation and has one simple aim: to cut red tape in the speech-language pathology field. Earlier this year, the Michigan Department of Health and Human Services changed its rules to allow speech-language pathologists to receive payment for Medicaid services, regardless of whether they possessed an additional certification. This additional certification specifically is a certificate of clinical competence, which is something that they achieve at the end of their education, often called a CCC, not to be confused with the CCC camps in Michigan history, okay? Before doing so, however, all practitioners were required to obtain this from the American Speech Hearing Association. This certificate, best known, here it is, as a CCC, is purely accessory to the state-regulated license that all speech-language pathologists must obtain to practice in Michigan. So it's almost like a double certification going on. A CCC costs $250 annually, yet does not impart any additional competence or skills, according to the experts in the field, and you'll hear more about that. For a career speech-language pathologist, this redundant requirement could cost upwards of $7,500 over a 30-year career, and assuming that the American Speech Hearing Association, a private entity, it's something that's totally separate from what goes on, does not increase its prices. Thus, many speech-language pathologists were adamantly opposed to this required MDHS mandate. Practitioners who either could not afford a CCC or refused to pay for it were barred from providing their services to low-income patients, which is, and when all is said, an injustice. And so, like I said a moment ago, MDHHS has recently changed its rules and no longer mandates a CCC. However, I believe it is our responsibility as a legislature to codify. So our goal is to codify this practice into law to ensure that it remains in effect. It's worth noting that under House Bill 4484, a speech-language pathologist has the ability to possess a CCC. You know, they still can pay the $250 a year. The choice is theirs if they wish. As my guests will testify to momentarily, however, speech-language pathologists are well-trained under current licensing standards. Colleagues, I ask for your support on House Bill 4484. Simply put, there is no justifiable reason to require speech-language pathologists to possess a CCC to provide services to Medicaid users. MDHHS came to this realization, and now it's time that we just codify this, agree with it. So thank you for this opportunity to testify this morning, and I now invite you to hear my guests, Jeanette Benigas and Alexa Suchner, and it's really Alexa Chapman now, right? Mm-hmm. Okay, Alexa was one of my former students at Fremont Christian School. So following Jeanette and Alexa's testimony, I'm happy to answer any questions you may have about House Bill 4484.
Thank you very much, Representative, and we'll take questions at the end. And Jeanette and Alexa.
Thank you for the opportunity to speak. My name is Dr. Jeanette Benigas. I am a licensed speech-language pathologist of 19 years, holding licenses in both Michigan and Ohio. I'm also a proud Eastern Michigan University alumni, coming up in a time when there was not a Michigan state license, so I'm very familiar with this topic. I'm a private practice owner and also the owner and founder of Fix SLP, which is a grassroots advocacy firm addressing challenges facing our profession. SLPs are proud to be the healthcare professionals uniquely qualified to treat feeding and swallowing disorders in premature babies, all the way up to helping seniors reclaim their voice after a stroke. We also provide care to children in schools, hospitals, and in private practice settings. One of Fix SLP's primary goals is to finally clarify that SLPs are credentialed by our publicly regulated licenses versus private certificates sold by a private third-party entity. As our profession has grown, the American Speech, Language, and Hearing Association, or ASHA, has expanded its influence too. While ASHA has helped to define who was an SLP in the mid-20th century, states have since taken those guidelines to establish 50 state licensing boards, including Michigan in 2011. This change has left some confusion among government agencies, employers, and insurances about the difference between ASHA's certification and a state license. House Bill 4484 makes one thing clear. In Michigan, a state license, not a private certificate, is the official credential to practice as a speech-language pathologist. A Michigan license ensures public oversight, ethical accountability, and consumer protection, the essentials in healthcare, and I might also add, is more rigorous to maintain than the CCC. By giving this bill a due pass recommendation, you'll give Michigan's licensed and credentialed SLPs the freedom to practice without a costly annual payment to a private third-party organization whose proprietary certificate is often confused as a license to practice. I'm happy to answer any questions also, and I thank you for this opportunity to speak.
Good morning. My name's Alexa Chapman. I'm a practicing speech-language pathologist in Northwest Michigan, and I'm here to express my support for House Bill 4484. In 2012, Michigan established a state-regulated license for SLPs, something now standard in all 50 states. Yet despite this, some public and private entities continue to require the purchase of ASHA's Certificate of Clinical Competence, or the CCC. In 2024, I joined a grassroots effort with Fix SLP to address state and federal regulations that were being ignored due to outdated copy and paste policies. After hundreds of volunteer hours, we've successfully lobbied the Michigan Department of Health and Human Services to clarify that SLPs may provide Medicaid services without the CCC. Nevertheless, private insurers and employers continue to confuse ASHA's certificate with our Michigan state license. House Bill 4484 protects and preserves the important changes that MDHS has made, ensuring that private and corporate interests are not embedded into our state law. Our Michigan state license is a rigorous and publicly accountable credential. Licensed SLPs should not be required to purchase certificates from third-party organizations in order to provide speech therapy to Michiganders. This bill will lower cost for providers, increase access to care, and retain qualified SLPs in our state. I urge you to support and ask for a do-pass recommendation on House Bill 4484. Thank you so much for the time to speak today.
Thank you very much. Committee, questions? Representative DeBoer.
Thank you, Chair. I was wondering, your area of expertise is probably especially needed now with kids coming out of COVID and not being in the classroom live to learn how to speak languages, how to perform, just talking. Are you noticing that?
Yes, I think that there has been some changes after COVID. I work in the public school system, and there has been some challenges after coming back from telehealth or virtual visits. So speech-language pathology is needed now more than ever, and we're just asking to reduce this barrier to care for our patients and clients that require Medicaid, that need Medicaid.
Yeah, I would think you'd become much more essential I had superintendents tell me that the kids can't speak.
I might also add that my specialization is in dementia and swallowing issues, and the reason I am licensed in Michigan is because speech-language pathologists are extremely hard to find, especially in the rural areas of Michigan. So I practice regularly in Ohio, and they licensed me in Michigan to provide teletherapy to a nursing home that had gone unstaffed for years. And so this CCC barrier makes it even harder when SLPs choose not to get it.
Yeah. Well, communication is so important for being human and for growing up in the world today. So appreciate what you do.
Thank you.
Representative Thompson.
Thank you, Mr. Chair. And my question was actually going to go to the school and with the children and the Medicaid reimbursement, but then you had mentioned something that I might want to touch on. So in schools, public schools, if you are doing the speech pathology for kids that have a speech impairment, are those families being billed by Medicaid right now?
So the CCC is not required for billing Medicaid in the schools. It was previously required in all other settings in the state of Michigan, up until MDHS just changed their rules and guidelines. But Medicaid is billed in the schools, but the CCC is not required. It's only required in skilled nursing facilities, hospitals, outpatient, private practice settings.
Thank you. And then touching on to what you said, so as a nurse and working in skilled nursing facilities, a lot of people don't understand that there's so many aspects to speech pathology. Not only is it speech with kids that have a tongue tie or an impairment, but the speech pathologist is the person that is performing the swallow study. If patients are choking or they have to change their thickness or their consistency on what they can swallow. So can you explain that a little bit to the committee on what that swallow study looks like?
Sure. It's exactly what I do. That's my private practice. I own Safe Swallowing Diagnostics. I own endoscopy equipment that I take into nursing homes to the bedside. The other option is to go to the hospital, which is quite disruptive, especially for someone who has dementia and maybe can't quite understand the change in environment. It's also can be a little more thorough, depending on what you're looking for. So we do that because aspiration, which is when food or liquid goes into the lungs, is the #1 killer of the elderly. So in order to identify what's going on and also the pathophysiology, why that's going on, is very important. So the speech-language pathologist can make a person-centered plan of care, treat what's going wrong very quickly, get to the root of the issue, and make sure that the person's quality of life is maintained, instead of these diet modifications like thickened liquids and purees, which have a whole host of other issues we know now. So avoiding that as quickly as possible is very important.
Any other questions from the committee? Seeing no other questions, thank you all for being here today. We really do appreciate taking your time out of your busy schedule. Thank you. Looking forward to working with Representative Fox to get this to the finish line. We do have one card to read in on House Bill 4484. Not wishing to speak, neutral on the bill, Kelly Pierce, Michigan Speech, Language, and Hearing Association. All right, with that, we're going to go back to our votes today. So first up, we have a substitute on House Bill 4306, which incorporates some changes that were requested by the Secretary of State. Representative Thompson moves to adopt the H1 substitute for House Bill 4306. Clerk, would you please call the roll?
On the motion to adopt the H1 substitute, Chair VanderWall,
Yes.
Representatives Thompson,
Yes.
Meerman,
Yes.
Tisdall,
Yes.
Beerline,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witsit, Carter,
Yes.
Whitwer,
Yes.
Neely,
Yes.
Hoskins,
Yes.
Foreman.
Yes.
Mr. Chair, you have 16 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Madam Clerk. The H1 substitute is adopted. Next, Representative Beerline moves to report House Bill 4306 with recommendation the bill be referred to the Committee on Rules. Clerk, would you please take the roll?
On the motion to refer to rules as substitute H1, Chair VanderWall,
Yes.
Representatives Thompson,
Yes.
Meerman,
Yes.
Tisdall,
Yes.
Beerline,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witsit, Carter,
Yes.
Whitwer,
Pass.
Neely,
Pass.
Hoskins,
Pass.
Foreman.
Pass.
Mr. Chair, you have 11 yea, 0 nay, 5 pass. The motion prevails.
House Bill 4306 is referred to the Committee on Rules as substituted. Now Representative DeBoer moves to report House Bill 4307 to the floor with recommendation. Clerk, would you please call the roll?
On the motion to report, Chair VanderWall,
Yes.
Representatives Thompson,
Yes.
Meerman,
Yes.
Tisdall,
Yes.
Beerline,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witsit, Carter,
Pass.
Whitwer,
Pass.
Neely,
Pass.
Hoskins,
Pass.
Foreman.
Pass.
Mr. Chair, you have 11 yea, 0 nay, 5 pass. The motion prevails.
House Bill 4307 is reported with recommendation. Next up, Representative St. Germain moves to report Senate Bill 303 with recommendation the bill be referred to the Committee on Rules. Clerk, would you please call the roll?
On the motion to refer, Chair VanderWall,
Yes.
Representatives Thompson,
Yes.
Meerman,
Yes.
Tisdall,
Yes.
Beerline,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witsit, Carter,
Yes.
Whitwer,
Yes.
Neely,
Yes.
Hoskins,
Yes.
Foreman.
Yes.
Mr. Chair, you have 16 yea, 0 nay, 0 pass. The motion prevails.
Thank you, Madam Clerk. Senate Bill 303 is referred to the Committee on Rules. Next up, we will be taking up House Bill 4558. Representative DeBoer has an amendment that she would like to speak to. Representative DeBoer, the floor is yours.
Thank you, Mr. Chair. I offer this amendment to improve this bill while still allowing patient access to telemedicine through virtual eye exams and contact lens prescription renewals. My amendment seeks to clarify bill language on page 5. Section 5560, which has been interpreted differently by stakeholders. Some believe that the current language of the bill allows online contact lens sales companies to actually change various parameters of a lens prescription, including base curve, brand name, lens type, diameter, wearing, and disposal parameters, and others, all without refitting the new prescription to the eye. My amendment would also address stakeholder concerns that there is no way to ensure patients have actually seen their in-person provider in the past 2 years or are receiving an accurate contact lens prescription renewal. This amendment would make sure that companies who offer this telemedicine healthcare service would have to have the patient's existing prescription on hand. With this amendment, the company can still offer the online exam to make sure the prescription is safe and renew that same prescription. This amendment strikes the right balance of giving patients access to telehealth options while making sure they receive accurate and safe lenses that have been physically fit to their eyes. I encourage you to vote yes. I move that we adopt this amendment. Thank you.
Thank you, Representative. Representative DeBoer moves her amendment. Clerk, would you please take the roll?
On the motion to adopt the amendment, Chair VanderWall,
No.
Representatives Thompson,
Yes.
Meerman,
No.
Tisdall,
No.
Bierlein,
Yes.
DeBoer,
Yes.
Preston,
No.
Schmaltz,
No.
St. Germain,
No.
Bohnak,
No.
Frisbee,
No.
Witsit, Carter,
No.
Whitwer,
No.
Neely,
Yes.
Hoskins, Foreman.
No.
Mr. Chair, you have 4 yea, 11 nay, 1 pass. The motion does not prevail.
Thank you, Madam Clerk. The amendment does not pass. Representative Bohnak moves to report House Bill 4558 with recommendation the bill referred to the Committee on Rules. Would the clerk please take the roll?
On the motion to refer, Chair VanderWall,
Yes.
Representatives Thompson,
No.
Meerman,
Yes.
Tisdall,
Yes.
Bierlein,
No.
DeBoer,
No.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witsit, Carter,
Yes.
Whitwer,
Yes.
Neely,
No.
Hoskins,
Yes.
Foreman.
No.
Mr. Chair, you have 11 yea, 5 nay, 0 pass. The motion prevails.
Thank you, Madam Clerk. 4558 is referred to the Committee on Rules. Next up, we'll be taking testimony on House Bill 4509, introduced by Representative Meerman. Representative Meerman, if you could make your way to the testimony table, you may begin when you are ready.
Good morning, Mr. Chair and members of this committee. Thank you for the opportunity to speak to this morning on House Bill 4509, my bill which would enter Michigan into the audiologist and speech pathologist interstate compact. Like the other compact bills this body has heard, this bill would allow, this bill would allow licensed audiologists and speech pathologists to practice across all member states in the compact. There are already 36 states entered into the compact, and reducing barriers for licensed professionals to expand their reach in healthcare is exactly what's needed to address the healthcare shortage, especially in rural and underserved communities. For the professionals looking to practice across multiple states, redundant licensure is an unnecessary obligation that this compact bill will address. So this bill not only reduces red tape for licensed professionals, it promotes greater access to care for those needing services. Entry into the compact would allow audiologists and speech pathologists to practice across state lines, both in person and through telemedicine practices. When we're considering our rural communities, allowing individuals to access remote telemedicine from the communities bridges the gap in healthcare access. I urge my colleagues on this committee to support this bill to enter Michigan into the audiology and speech pathology compact. Thank you, Mr. Chair and members of this committee.
Thank you, Representative, and I know your guest is Dr. Chelsea Conrad. Is that correct? Very good. The testimony table is yours.
Good morning. Thank you, Chairman VanderWall and committee members. I appreciate your time to speak on this topic today. As Chairman VanderWall said, I'm Dr. Chelsea Conrad. I'm a clinical audiologist currently practicing at Henry Ford Health in Detroit. I'm also here on behalf of the Legislative Committee of the Michigan Audiology Coalition, which represents licensed audiologists in the state. I'm here in support of the Audiology and Speech Interstate Compact. The professions of audiology and speech are separate and unique, but share a rich history, including an undergraduate education and one parent organization of the American Speech, Language, and Hearing Association. This compact has already been passed by 36 states, and I'm hoping Michigan becomes the next state to enter into the compact agreement. First and foremost, this compact allows us to provide the best care to our patients. That includes my existing patients here within the state of Michigan that perhaps travel to warmer weather in the cold months. It provides care to patients that live on borders and allows them to access the provider of their choice. This increases cost efficacy for providers as they don't have to pay redundant licensure fees across multiple states, however, still maintains strict quality controls and reporting among member states for any bad actors and disciplinary measures. This allows our audiologists that are military members that may move frequently to practice seamlessly across state boundaries. I thank you for your time and appreciate your consideration in bringing this care to all of our patients as well as our providers that we represent.
Well, thank you, Doctor, for being here and taking time. Committee, any questions? You guys did a great job. Thank you very much. Again, I appreciate it. I believe we also have wishing to speak in support of the bill, Kelly Pierce and Anna Claudia Harton. Hopefully I pronounced that right. All right. Michigan Speech and Language and Hearing Association, thank you both for being here. And again, when you're ready to speak, just make sure the red light's on at the base and the testimony table is yours. Thank you.
Good morning. Thank you, Mr. Chair and members of the committee for hearing our testimony on House Bill 4509, which again would provide the interstate compact for speech language pathologists and audiologists. My name is Dr. Kelly Pierce. I'm a VP for advocacy for the Michigan Speech Language Hearing Association, and I've been a practicing SLP for 14 years now. We've provided written testimony in support of this bill. So in the interest of time, I'm going to keep this brief and concise. This compact would benefit SLPs and audiologists in Michigan for a number of reasons. As stated, it really will increase access to necessary services for clients, whether that's delivered via face-to-face or in telehealth modalities. This is especially important in rural areas and areas in Michigan that share borders with other states. As stated, currently 36 other states have passed this compact and have entered into it, and that includes Wisconsin, Ohio, and Indiana. So our bordering states have this compact, and providers could then provide care to individuals in those areas, and thereby they would have greater access. It also encourages providers in other states to practice in Michigan, reducing delays in care, and increases the number of available practitioners for individuals with communication and swallowing challenges. The second reason this would be beneficial is that SLPs in Michigan would have greater access to employment opportunities, and allowing them the freedom to practice in a number of settings and specialize more readily, and allows employers to attract and retain talent within Michigan. It benefits members of the military and their families. SLPs would be able to move between compact member states without necessitating the lengthy and burdensome administrative processes in each state. Strong licensure standards are maintained, while military families would be better able to relocate without additional financial and administrative burdens. The compact provides consumer protections across state lines. There's a shared data utilization, and communication would be increased across the states. Providers would need to maintain the requirements for each state and disciplinary action would be communicated easily for any bad actors. Passing House Bill 4509 would help Michigan reduce the workforce shortage in the state, increase access to care, and reduce delays for individuals requiring communication and swallowing supports, and improves consumer protections. We appreciate your support in this manner and are open to any questions you might have.
Thank you very much for being here. Representative Frisbee.
Section 14, thank you, Chair, finding effect. Can you explain that about how it supersedes and what rules and laws in Michigan would we have to suspend in order to do this?
I am not familiar with that. I'd have to look into that and
Might be a
get back
better
to that.
question for the Mr. Meerman. Do we know any of those?
Representative Meerman. You can answer from your
Yeah. So you're asking, the question is what things might be superseded?
Yes.
Yeah, the compact does take sort of precedent in the rules there, but what doesn't get superseded is the state's ability to be in control of the license. So if they decide the audiologist shouldn't have a license or just the investigation process, the state is in control of that.
Okay, thank you. That was my concern.
Yeah.
And I appreciate you addressing it. Thank you.
If I may add one thing, so
You
we'll
could turn your
still
mic
be-
on for us, please.
So sorry.
The little red button at the base. Thank
It
you.
is red.
Is it on?
Can you hear me? Sorry about that. So Lara would still have control on the license for the, that would not be subsided by any other regulations that we have. Fees would be also the same, other than if you want to practice on the compact other states, then would apply other fees for them, so it would be additional.
Very good. Any other questions from the committee? I have one for you, and we've worked on a lot of compacts, as you're well aware. Do we have an estimate of how many counselors or speech counselors would be able to come into the state of Michigan from our neighboring states to work? Is there a rough idea?
I don't think we have that data yet. The compact, while 36 other states have agreed to or have passed this legislation, it doesn't go into effect until, I believe, later this year.
Oh, okay. Very good. Very good.
Dr. Conrad has an answer.
If the doctor would like to come back up to answer that question, we would appreciate that. I think it's very pertinent. Thank you.
Thank you. So regarding the question regarding what would be superseded by Michigan law, each practitioner is still obligated to follow the scope of practice and licensing laws within the state that they're providing care. So that is on the obligation of the provider to follow.
Very good. Thank you. Any other questions? Seeing no other questions, I want to say thank you again to all of you for being here today and discussing this important issue. Appreciate your time.
Thank you.
We have several cards to read in on this bill. Not wishing to speak in support, Taylor Alpert, Michigan Health and Hospitals. Not wishing to speak in support, Christine Shear, Michigan Association of Health Plans. Not wishing to speak in support, Jason Lakowski, AARP. Not wishing to speak in support, Janelle Bengus, Fix SLP. Not wishing to speak in support, Alexa Chapman, Fix SLP. Thank you. Appreciate all of you being here. Get my notes back out. Next up, we will be taking testimony on House Bill 4591, introduced by Representative Bohnak. Representative, you can make your way to the testimony table, and when you're ready, the floor is yours.
Thank you, Mr. Chair. Today I rise in support of my bill to admit Michigan into the Counselor Compact. This interstate agreement is a great step forward in enhancing access to mental health services for all Michiganders. If enacted, this bill would allow licensed professional counselors in member states to practice across state lines, both in person and via telehealth. This would help expand access to care by allowing qualified professionals to practice in our state, which will benefit especially our underserved communities. Other compact agreements have proven to be successful for other medical professionals, and allowing counselors the same opportunity would be one step forward in tackling Michigan's rising mental health problem. As of this month, there are 34 states that have enacted the Counselor Compact, with Arizona, New Jersey, and South Dakota among the most recent to join. Thanks again. If you have any questions, I'll try to answer them.
Very good. I know that we have several people that would like to testify. Any questions for the representative? Seeing none, thank you, Representative. You can make your way back, and then I will call up Dr. Stephanie Burns, MMHCA, and I am assuming that Carol Berger is going to come up at the same time. Is that correct? Very good. From the MMHCA. Thank you both for being here. When you're ready, if you could turn on the mic, the testimony table is all yours.
I think my mic is on already. All right, thank you. Honorable Chair and esteemed members of the committee, thank you for the opportunity to speak today. My name is Carol Berger, and I'm a licensed professional counselor in private practice in Owasso, Michigan. I've been a counselor for over 20 years. I'm also the secretary of Michigan Mental Health Counselor Association, MMHCA, and it is on behalf of MMHCA and our members that I'm here before you today. In Michigan, there are approximately 12,000 counselors. Just to let you know, currently approximately 10% of those counselors reside outside of Michigan. With the Counseling Compact, we're given privileges to practice in other states. The Counseling Compact is not enacted yet. States have enacted the law, but the Counseling Compact is not up and running yet. So we haven't had a chance to see how a lot of certain things play out. Currently, we can get licensed in most other states, and so the 10% of counselors that are counseling in Michigan but living in other states have gotten a Michigan license to do so. At this time, MMHCA has not taken a formal position on the Counseling Compact. We recognize the potential benefits that have been outlined, including improved mobility and access to care, but we also have some concerns that require further evaluation. A preliminary survey of counselors across Michigan shows mixed opinions on the compact, and we believe it's important to take the time to fully understand the long-term implications. We are currently gathering input from our membership and reviewing the potential impact on both providers and clients before making a formal recommendation. We've been exploring the compact for over a year. Still, at this point, there are unanswered questions about whether it will address the mental health needs of Michigan residents. We have seen the legislative report and are concerned that the Counseling Compact is potentially being viewed as a solution to rural mental health needs. Unfortunately, we're not sure that's the case. Don't get me wrong, it may be of some help, but there are larger factors impacting the lack of rural mental health care. First, assuming that allowing counselors from other states to practice in Michigan will result in a large influx of non-Michigan counselors assumes that there is a surplus of counselors in other parts of the country. As far as we know, that is not the case. In fact, the compact will most likely result in more counselors wanting to provide mental health services in states with the highest insurance reimbursement rates. If Michigan doesn't have higher reimbursement rates, the compact won't result in a net increase of counselors. In fact, it could result in the opposite. Michigan counselors practicing outside Michigan to receive higher reimbursement rates. For example, though Medicaid reimbursement rates are definitely lower in some states, Medicaid reimbursement rates are significantly higher than Michigan in other states. Second, if more counselors do provide mental health services from out of state, it will be through virtual therapy sessions, mostly. That means the physical infrastructure must be in place to serve those rural clients. If the clients don't have high-quality internet, virtual therapy will not be a possibility and the compact won't be the solution. Third, out-of-state counselors will not be familiar with the Michigan local support services in case of a client emergency. Yes, the compact says that they should be, but the compact is not in effect yet, so we don't know if that is a reasonable expectation. Lastly, compact law will supersede Michigan law, which is concerning given parts of the law are not completely written yet. I may be sounding negative about the counseling compact, but I don't mean to be. The compact does have potential, but it isn't operational at this point, like I said. They haven't written all of the legislative rules yet, rules that will override the Michigan Public Health Code. Those are serious issues to be thoroughly reviewed. We are proposing that we help you truly examine the mental health issues in Michigan and explore whether the counseling compact can have a reasonable impact on helping with mental health in Michigan. We would like to help you make the best decision for the residents of this great state. Thank you.
Honorable Chair and esteemed members of the committee, thank you for allowing me to speak today. I'm Dr. Stephanie Burns. My full-time job is at Western Michigan University, and I'm a counselor educator, which means that I train LPCs. I've been an LPC myself for over 18 years, and I also happen to be a member at large of Hauck, and that's how I'll be speaking with you today. I'll just be elaborating on some of the other reasons why at this very moment we're taking a neutral stance. While certainly it can make some aspects of obtaining a license in another state for an LPC easier, each state can require additional exams. They can require additional things that have to happen. So it's not as easy as we become part of the compact and then Michigan counselors can just automatically practice anywhere. Also, Michigan LPCs who have the privilege to practice in another state through the compact, they do have to know all the various counseling laws and rules in those other states when seeing clients in that state. And some states' laws can contradict each other. And part of the reason for our neutral stance at this moment, as we're collecting more information from the nearly 12,000 counselors that are licensed in the state of Michigan to understand their thoughts on it, is that it can be hard for counselors to negotiate that when there's a conflict there. We also are noticing many venture capitalist companies creating or backing very large multi-state counseling companies. One example of that is BetterHelp. These companies' business practices often violate our American Counseling Association Code of Ethics, and so the 2014 Code of Ethics more specifically, and counselors following these companies' business practice are often caught in a situation of, in order to keep the job, violating the Code of Ethics. We also know that some of these companies have been found guilty of things like breaches of confidentiality and the like. We're concerned that venture capital backing could possibly make it more difficult for our private counseling practice owners who already are operating in the state of Michigan to survive and compete with these large venture capital backed companies. And it was already touched on about the fact that certainly Hauck, and as a counselor educator myself, we're very concerned about being able to provide services to all of the residents of Michigan, including those in rural areas. And certainly it is very difficult at times to do that because of everything from broadband internet access or just having physical presences in rural communities. And, you know, as a counselor educator over the years, as I'm training counselors, more and more counselors are understanding that with the low rates that Medicaid often is reimbursing at, that they are not looking at working with those clients because just like everyone, counselors need to be able to pay rent and have food on the table and things of that nature. We are more concerned that that we would like the Medicaid. We're concerned about the federal cuts or any kind of state cutting of Medicaid reimbursement rates to improve rural practice and providing services to rural members of the communities. And the last thing I'll just touch base on really quickly is that we defer completely to Laura on this subject, but we do have some of our own thoughts about what the fiscal impact might look like. It could have a significant fiscal impact on the Department of Licensing and Regulatory Affairs, but we're not exactly sure of the magnitude of that. We don't have a precise estimate at this time. Certainly, Laura would incur costs for investigating complaints against licensees and for the general administration and implementation of the compact's requirements. And it would include any incurred expenses for integrating Michigan's current licensing system with the Compact Commission's data system. And we just don't have numbers for that, obviously deferring to Laura for those. But we do know that the Counseling Compact Commission could levy annual assessment on the state of Michigan to cover the costs of the commission's activities and operations. And there could be liabilities if Michigan defaulted on the compact. And there's a lot of factors that could bring up. The bill, the Counseling Compact, would allow Laura to recover costs related to investigations and disposition of adverse action cases. And Laura has indicated that additional legislation would be required to allow the department to collect those fees. It's obviously up to Laura and all of you to figure out how that would compare and what costs would incur. And there is the potential that traditional licensure revenues in the state could decline as out-of-state licensees would be able to do practice via the compact. So again, thank you just very much for letting us lay out just why at this particular moment we're taking a neutral stance on this. Thanks again.
Thank you. Any questions? Yes, Representative Preston.
Thank you, Chair. Just to the extent that you guys can foresee, do you see this compact facilitating continuity and continued mental health services across state lines? We're up in the upper peninsula. A lot of our care is commingled across the border with Wisconsin. When residents find themselves, receiving acute care on the other side of the border, how do you see this compact playing out?
I'll at least take the lead on fielding this. You are absolutely correct in terms of border. Wisconsin, our southern states, and even as was previously mentioned in regards to a different compact, we have some individuals who go to other states in the winter and things like that. Certainly, that would help a lot.
Well, I can give you a precise example. In southern Menominee County, our medical control is on the Wisconsin side. So a lot of our Michigan residents for mental health services that are acute find themselves with ADAPT, which is Wisconsin-based. Part of the problem is they'll run through the system at ADAPT, they'll get discharged, and then North Point, which is on our side, there is no follow-up. Do you see a compact like this creating that continuity of care and continuing to support that patient when they cross the state lines back into the home state?
Absolutely, yes.
All right. Thank you.
Representative Thompson.
Thank you so much for your testimony. Do you not agree with all state licensure compacts with other states, or just specifically the counseling one, and if so, why?
Sorry, wanted to touch base. There are a lot of good reasons for counseling compacts, and I can tell you as a counselor educator, we often, I'm often training students while they may be getting their degree from Western Michigan University, they'll be leaving to go to another state. So absolutely no, we have no problem with that at all. It is a welcome. It's the concern becomes that we have a lot up in the air. So absolutely, the idea of compacts is good.
You would just like to see a little more work done on this, or would you be willing to work with the sponsor and the other stakeholders?
Oh, absolutely. Mahaka wants to work. Yes, we definitely want to work with all of that. And again, we, just as an aside, we weren't notified until Monday late afternoon that this was coming to committee. And so we are trying to, at least right at this moment, our goal is to talk about the pros and the cons of it. And we, as I've stated previously, we've sent out a survey to all nearly 12,000 licensed counselors in the state. We're getting their data and their input, and we will be coming back to another hearing to give a formal for or against.
Thank you for your time.
Any other questions from the committee? I do have one. It pertains to the education side. How many students right now are you in touch with and teaching, and how many of them actually leave the state of Michigan? What a rough estimate percentage-wise? Have you had 100 to 60% of them stay here in Michigan and 40% leave, or?
I so wish I could give you that chunk of information. Sadly, at Western Michigan, we aren't giving any kind of a formal survey where we're literally asking students, are you leaving the state and are you not? I only teach at the master's and doctoral level, and it's just about becoming an LPC. And those conversations come up privately we serve as the advisor for them directly as they move through their degree program. So I don't know about students' intentions unless they tell me about it in advising appointments. I wish I could give you that number, but I sadly don't have a number to offer you.
Thank you very much. We look forward to working with you on that. Any other questions from the committee? Yes, ma'am.
Thank you, Representative VanderWall. I just wanted to speak to Representative Thompson's question just a little bit.
Very good, thank you.
Part of the problem is that the compact law isn't completely written yet. So we're just concerned, given especially that it does supersede Michigan law, unless it doesn't supersede our Constitution, but it can supersede the Public Health Code. So given that it's not completely fleshed out yet, that is a big concern of ours. We'd be a lot happier waiting to see it get finished and maybe even run in the other states for a while to see how it goes.
Go ahead.
So there is not an active compact with other states. I thought that we, in the information that we were given, that there were other states that were in an active compact.
There is compact law that's been written, and many other states have adopted that law, but the law is not completely written. they're still fleshing out important parts of it.
All right.
Gordon, no,
Go ahead.
that's okay. We can further the conversation later. We can move on.
Very good.
Thank you.
Thank you. Thank you both for being here. Appreciate it. We have a couple other cards to read in. Not wishing to speak in support of the bill, Taylor Alpert, Michigan Health and Hospital. 4591, not wishing to speak in support of the bill, Jarrett Scoop, Mackinac Center of Public Policy. Also, before we adjourn today, we do have some guests in the audience today from the future public health leaders from the University of Michigan. I want to say welcome to all of you. Thank you, Representative Carter, for getting me the information very much. But welcome. I hopefully you enjoyed the committee today, and congratulations on what you're doing, and continue your good work. We appreciate it. Seeing no absent, Representative Whitwer moves to excuse absent members. There being no objection, the motion prevails. There being no further business before the committee will stand adjourned.